Long COVID is a term that has emerged in the wake of the COVID-19 pandemic, referring to a range of symptoms that persist long after the initial infection has resolved. For many, the journey doesn't end with a negative test result. Instead, they face ongoing health challenges that can last for weeks or even months. These persistent effects can include fatigue, brain fog, respiratory issues, and a host of other debilitating symptoms that significantly impact daily life. In this video, we aim to provide an informative and supportive space for those affected by long COVID. Understanding the complexities of this condition is crucial, not just for patients, but also for their families and caregivers. By exploring the various symptoms, available treatments, and effective recovery strategies, we hope to empower viewers with knowledge and resources. It's essential to recognize that you are not alone in this experience, and there is a growing community of support and research dedicated to helping those navigating the challenges of long COVID. Let's dive deeper into this important topic together. What is long COVID? Long COVID, also known as post-acute sequelae of SARS-CoV-2 infection, PASC, refers to a range of symptoms that persist for weeks or months after the initial COVID-19 infection has resolved. While most individuals recover within a few weeks, a significant number experience lingering effects that can emerge anywhere from a few days to several months post-infection. Common symptoms include fatigue, difficulty concentrating, and shortness of breath, which can severely impact daily functioning. The medical community has increasingly recognized long COVID as a serious condition, with various health organizations acknowledging its significance. Research indicates that approximately 10% to 30% of individuals who have had COVID-19 may experience long-term symptoms, regardless of the severity of their initial illness. A study published in the Journal of the American Medical Association found that nearly 30% of patients reported persistent symptoms 3 months after their diagnosis. This growing body of evidence underscores the importance of understanding long COVID, as it affects millions of people worldwide and highlights the need for ongoing research and support for those impacted. Common symptoms of long COVID. Patients experiencing long COVID report a diverse array of symptoms that can significantly disrupt their daily lives. Among the most common are fatigue, often described as overwhelming and unrelenting, brain fog, which can manifest as confusion or difficulty concentrating, and respiratory issues, including shortness of breath and persistent cough. Other symptoms may include joint pain, headaches, sleep disturbances, and heart palpitations. It's important to note that the symptoms of long COVID can vary widely from person to person. While some may experience only mild discomfort, others may find their symptoms debilitating, affecting their ability to work, socialize, or engage in everyday activities. This variability can make it challenging for both patients and healthcare providers to navigate treatment options effectively. The impact of these symptoms extends beyond physical health. They can also take a toll on mental well-being. Many individuals report feelings of anxiety, depression, and isolation as they grapple with the uncertainty of their recovery. Understanding these symptoms and their effects is crucial for fostering empathy and support for those living with long COVID as they navigate this complex and often frustrating journey. Diagnosis of long COVID. Diagnosing long COVID can be a complex process, as there is no single test that definitively confirms the condition. Healthcare professionals typically rely on a combination of patient history, reported symptoms, and clinical assessments to make a diagnosis. The criteria often include the presence of symptoms that persist for at least 4 weeks following the initial COVID-19 infection, with a focus on those that significantly impact daily functioning. An essential step in the diagnostic process is ruling out other potential conditions that could explain the symptoms. This may involve a thorough evaluation of the patient's medical history, physical examinations, and discussions about any pre-existing health issues. Doctors may also recommend specific tests, such as blood tests, imaging studies, or pulmonary function tests, to assess organ function and identify any underlying health concerns. Ultimately, the diagnosis of long COVID requires a collaborative approach between patients and healthcare providers. By carefully considering the symptoms and conducting appropriate assessments, doctors can help ensure that individuals receive the support and treatment they need to manage their condition effectively. Treatment options for long COVID. When it comes to managing long COVID, a variety of treatment options are available, encompassing both conventional and alternative approaches. Conventional treatments often focus on symptom management and may include medications such as anti-inflammatory drugs, pain relievers, or antidepressants to address specific issues like fatigue, pain, or mood disturbances. In addition to medication, rehabilitation and therapy play a crucial role in the recovery process. Many patients benefit from physical therapy to improve strength and endurance, while cognitive rehabilitation can help address brain fog and memory issues. Occupational therapy may also assist individuals in adapting their daily activities to better cope with their symptoms. Alternative treatment approaches, such as acupuncture, mindfulness practices, and nutritional therapy, are gaining popularity among long COVID patients seeking holistic relief. These methods can complement conventional treatments and promote overall well-being. Ultimately, the best treatment plan is often personalized, taking into account the unique symptoms and needs of each individual. By exploring a combination of therapies and support, patients can work towards alleviating their symptoms and improving their quality of life as they navigate the challenges of long COVID. Recovery journey. The recovery process from long COVID can vary significantly among individuals, with some experiencing gradual improvement, while others may face prolonged challenges. Factors such as the severity of the initial infection, pre-existing health conditions, and individual resilience can all influence recovery times. It's essential for patients to understand that there is no one-size-fits-all timeline, and patience is key during this journey. A supportive care network plays a vital role in the recovery process. Family, friends, and healthcare providers can offer emotional support, practical assistance, and encouragement, helping patients navigate the ups and downs of their symptoms. Connecting with support groups or online communities can also provide a sense of belonging and shared experience. To manage symptoms and promote recovery, patients can adopt several strategies. Prioritizing rest and pacing activities can help prevent fatigue from becoming overwhelming. Incorporating gentle exercises such as walking or stretching can improve physical endurance. Additionally, practicing mindfulness techniques such as meditation or deep breathing can alleviate stress and enhance mental well-being. By taking proactive steps and leaning on their support network, individuals can foster a more positive recovery journey as they work towards regaining their health. Living with long COVID. Managing life with long COVID can be challenging, but making certain lifestyle changes can significantly help alleviate symptoms. Prioritizing a balanced diet rich in nutrients can support overall health and energy levels. Staying hydrated is equally important, as it can help combat fatigue and improve cognitive function. Establishing a consistent sleep routine can also enhance rest and recovery, allowing the body to heal more effectively. Mental health support is crucial for those living with long COVID. The emotional toll of dealing with persistent symptoms can lead to feelings of anxiety and depression. Engaging in mindfulness practices such as meditation or yoga can promote relaxation and improve mental well-being. Seeking therapy or counseling can provide a safe space to process feelings and develop coping strategies. Additionally, it's essential to connect with others who understand the experience of long COVID. Joining support groups, whether in person or online, can foster a sense of community and shared understanding. Professional help from healthcare providers specializing in long COVID can also offer tailored strategies for managing symptoms. By embracing these practical approaches, individuals can navigate their daily lives with greater resilience and hope for recovery. Conclusion. In this video, we explored the critical topic of long COVID, emphasizing the importance of understanding its symptoms and available treatments. We discussed how long COVID can manifest in various ways, affecting individuals differently, and highlighted the need for a comprehensive approach to diagnosis and management. Recognizing the persistent nature of these symptoms is essential for both patients and healthcare providers. We also touched on the various treatment options, including conventional and alternative therapies, and the vital role of rehabilitation in the recovery process. It's important for those affected to take proactive steps in their recovery journey, whether through lifestyle changes, mental health support, or connecting with a community of others facing similar challenges. As we wrap up, we encourage you to stay informed and engaged in your health journey. If you found this video helpful, please consider subscribing, liking, and sharing it with others who may benefit from these insights. Together, we can raise awareness about long COVID and support those navigating its complexities. Thank you for watching, and we look forward to bringing you more valuable health information in the future.